As some of you may know, my father, for many years, has been a serving minister in the Church of Scotland. And whenever I feel nervous at addressing an audience on ecclesiastical matters, I reflect on a story that my father told me of a colleague of his in the ministry who, to his horror, discovered that he had completely forgotten the name of the couple he was supposed to be about to marry. But because this particular minister had a great deal of experience, by the end of the final verse of the first hymn, he had come up with a cunning plan and addressed the bridegroom at the end of the first hymn in the following words: "In what name do you present yourself for marriage this day?" And back came the reply, "In the name of the Father, the Son, and the Holy Ghost." Can I say in all seriousness, it is, notwithstanding the audience and the august setting, a genuine pleasure for me to be here, both representing the Department for International Development and also working, of course, with the Tony Blair Faith Foundation. And I'm delighted that, at least for this series, we will be casting aside the rather tired old cliché that suggests that the two subjects not to be raised in polite company are religion and politics, and that they certainly should not be brought together. I know that this is an issue that previous speakers, not least Tony Blair himself, have touched upon in their remarks, and some have referred to a blind spot for faith in UK policymaking on development. This evening I want to suggest a different understanding of the relationship between faith and development, based on my own experience of the power of faith groups to advocate in the cause of tackling poverty, the excellence that many faith-based organisations show in delivering basic services across developing countries, and also the reach and importance that faith has across much of the developing world today. And I want to suggest to you this evening that closer relationships between people whose primary motivation in tackling poverty is their religious faith and people who take a more secular approach to development will be vital if we are together to fulfil our shared vision of getting every child into school and improving access to life-saving healthcare. This seminar series is, of course, intended as a step towards building those better relationships. I think many of us here this evening would agree that such a series just wouldn't have happened 10 or 15 years ago. And in the past, governments and political parties have sometimes given the impression that they are happy to talk to faith organisations about policy, but only on the basis that faith is somehow left behind. I think that's changing now, and I think it's changing for the better, and not before time. Because while there may be a prevailing assumption that the importance of faith has diminished here in the United Kingdom over the past 50 years, the last census showed that 3/4 of the population of this country described themselves as having a faith, and if we look across the world, we see that the reach and the power of faith is growing, not diminishing, and that the shape of faith is changing. In many parts of Central and South America, Protestant evangelicals are challenging the contemporary dominance of the Catholic Church. In China and the former Soviet Union, religious and spiritual movements are stirring after a long hibernation. Secular Arab nationalism has been challenged, of course, by a resurgent Islam stretching from North Africa to South Asia, and Christianity continues to grow apace across Africa and Asia itself. So even the most secular politician or development expert looking at the world today is led to a realization, surely, that faith cannot simply be ignored. Now, as I sought to reflect in my opening remarks, I've long understood the important role that people of faith have in tackling poverty. Growing up as I did in a manse where my father was a minister for more than 30 years, I saw in a very first-hand way the role of the church in helping those in our community who are in need of assistance. I was brought up to look beyond the community in which I was raised. Indeed, I can freely admit this evening that I was delivering Christian aid envelopes long before I was delivering Labour Party leaflets. But if anything, the influence of the churches on international development has surely grown in recent decades. Only 4 years ago, on July the 2nd, 2005, as I pushed my daughter in her pram along the streets of Edinburgh as part of that great demonstration, the largest demonstration ever witnessed in Scotland, I had cause to reflect that the real spine, the real backbone of that huge crowd of humanity gathered in Edinburgh were indeed people of faith. Indeed, many people underestimate just how much the Make Poverty History movement, just like the Jubilee 2000 movement before it, was made up of people of conscience and goodwill who came together not to ensure that profits trickle down, but to ensure that, as the ancient scripture puts it, justice flows like a mighty river. Those movements helped to deliver the aid increases and debt cancellation that have helped today to get 40 million more children into school in the developing world. They helped to increase the number of people with access to AIDS treatment from just 100,000 at the turn of the century to over 4 million people today. Yet the role of faith groups in creating public support for development in this country is, I would suggest, not limited to the great networks of campaigning and advocacy that have been created over the past decade. At a much more profound, at a much deeper level, the faiths provide both a repository and a transmitter for the moral and ethical values that motivate many engaged in the work of development. For as it is written in the Torah, love thy neighbour as thyself, so too the Prophet Muhammad said, that which you want for yourself, seek for mankind. As Buddhists teach us, hurt not others in ways that you find yourself hurtful, aspire to treat others as you would be treated yourself. As Christians follow the code to do unto others that which would have them done unto you, Hindus proclaim the sum of duty is not do unto others what would cause pain if done to you. That is a golden thread that runs through all of the great religions. And it is surely this understanding of humanity across the great faiths, and indeed common to the great faiths of the world, that has provided, I would argue, the moral and ethical foundations without which neither the Millennium Development Goals nor the Universal Declaration on Human Rights would have been conceivable. Despite the tragic examples of where people claiming to act in the name of faith and religion have promoted inequality, hatred, and even violence, I believe that the great faiths have at their heart the equal worth of every man, woman, and child, and it is to the credit of many people of faith that they dedicate their lives to addressing the imbalance between the innate equality that I've spoken of and the terrible inequity that persists around our world today. I know that many of you in this room are part of that fight for social justice and represent organisations that have gained, rightfully, global reputations for programmatic excellence, some of which I've had the good fortune to witness myself in my travels across the developing world. Yet on those visits, I have also been struck by the countless smaller acts of charity undertaken by people of faith, far from the cameras and far from public scrutiny. Earlier this year, I visited Goma in the east of the Democratic Republic of the Congo, where I saw a camp for people forced to flee the terrible violence afflicting the region. But I also visited the town itself, where I saw for myself much needed shelter, food, and healthcare being provided for literally thousands of people. I met some of the hundreds of Congolese people at the instigation of local priests and churches who had taken those displaced into their own homes and shared what little they had with their families. That experience this year was, for me, just the latest powerful reminder of the importance that faith has in providing for the vast majority of people across the developing world both a way of understanding the world and of interacting with it. And if we want to help individuals, communities, and countries across the developing world to lift themselves out of poverty, then understanding and harnessing the power of faith will be vital to that task. Perhaps nowhere is it more important that we harness that power than in the efforts to get every child into school and improve access to life-saving healthcare, the subject of our discussions this evening. The faith traditions have always understood and tended to both the needs of the body in healing the sick and the needs of the soul in providing the education that gives rise to the opportunity for people to realize their true human potential. Indeed, today there are as many as 120,000 Catholic-affiliated schools alone across the world. In Lesotho, to give just one example, as much as 90% of all primary education is today delivered by faith groups. And faith-based organisations, alongside the strong support we provide for public provision, have played an important role in the progress that we are seeing in getting more children into school. Over the last 7 years, the number of children out of school, I'm glad to say, has fallen by 28 million. But that progress will slow because the majority of the remaining 75 million children who are today without school live in areas of the world that are simply the hardest to reach. More than half of them live in countries affected by conflict. And it's here that faith-based organisations can perhaps make the biggest single difference, because they reach into communities where others cannot. In southern Sudan, the Episcopal Church of the Sudan, supported by the Archbishop of Canterbury's education programme, has today 300 schools serving 80,000 children of all faiths. My department is currently consulting on the future direction of our education strategy to ensure that the £8.5 billion we've committed to invest in education has the greatest impact on getting children into school no matter where they live. And I'd encourage any of you who haven't done so to contribute your thoughts on how we can most effectively deploy those resources. But just as faith groups are vitally important in the task that we've set ourselves in areas like southern Sudan, they are also vitally important providers of education and of health in countries across the developing world. In Nigeria, the Christian Health Association delivers almost half of all primary healthcare services. Churches and faith-based groups in a number of African countries have helped to dramatically increase the use of insecticide-treated bed nets for malaria, in some cases from 20 up to over 90%. In the time that I have left to speak this evening, though, I want to focus on two healthcare challenges where faith groups could make an even greater difference in the fight against AIDS and in preventing the deaths of mothers in pregnancy and in childbirth. Making progress in each of these areas will not only require the delivery of more resources, though of course that matters where there are too few clinics, too few doctors, too few medicines, but to make progress on HIV and maternal mortality, we also need critically to change attitudes that have in times persisted for generations. Let me turn first to the issue of HIV and AIDS. As I've already said, more than 4 million people today across the developing world are now using antiretroviral drugs, which represent tremendous progress in recent years. That treatment is often provided by faith-based organisations. The Catholic Church works in some 16,000 health centres across sub-Saharan Africa alone. Yet for every person newly on treatment, 3 more people are infected with the HIV virus. As many of you in this room know, there has been, of course, an honest disagreement both within and with some faith-based organisations on the appropriate role of contraception in preventing the spread of that deadly virus. So let me be clear, the United Kingdom government does not promote abstinence-only messages as a strategy for HIV prevention and pregnancy reduction for young people. None of the available evidence supports abstinence-only programmes as an effective strategy for HIV prevention. Instead, DFID promotes the full, as we call it, ABC message as a comprehensive and balanced strategy for HIV prevention and pregnancy reduction for young people. A for abstinence, B for be faithful, and C for correct and consistent condom use. Yet preventing the spread of this deadly virus and indeed of the disease will also require tackling the stigma that persists across much of the developing world and stops people today from getting tested, seeking treatment, and admitting their positive status to others. One source of this stigma is the mistaken belief that being HIV positive is somehow a punishment from God. So faith leaders have a particular role to play and responsibility, I would argue, to move communities from shamed silence to dialogue and to action on HIV and AIDS. That's why my department has supported faith leaders who are HIV positive to share their HIV status publicly and tell their own stories of leading productive lives. When Zimbabwean pastor Maxwell Capacho became ill, he didn't suspect HIV at first, but 3 years later, his health deteriorated so much that he was ordered to leave his ministry. He said then that he wanted to die quickly before his community found out about his illness. But a fellow pastor helped Maxwell to change his mind and convince him that God would not judge him for his HIV status. Inspired then by a DFID-supported workshop for HIV-positive religious leaders, Maxwell spoke to his congregation about his own circumstances and his own situation. 3 weeks after disclosing his own status to his congregation, 3/4 of that congregation testified that they had gone for an HIV test. They were happy to know their status, said Maxwell, because they had seen life in me. For too many people today across the developing world, HIV, of course, remains a death sentence. when we know it is possible to live a long and productive life with access to the right care and the right treatment. And for too many women across the developing world, what should still be the happiest day of their lives is in fact the last day of their lives, because every minute today, a woman dies from complications in pregnancy or in childbirth. What is so frustrating is that we have the technology to save these women, and we have the understanding as to what is required. Yet in too many places today around the world, it is the political will that is lacking. As Radhika Kumarasari, the former UN Special Rapporteur on Violence Against Women, has said, and I quote directly, "The biggest problem we find is that people are using culture and religion to deny women's rights." That's been the case in northern Nigeria, where many women need permission from husbands to attend local medical facilities. The tragic result is that many women give birth unattended at home, and around 1 in 10 women still die in either pregnancy or childbirth. So my department has worked with local religious leaders to give them information as to the benefits of hospital or assisted delivery. They in turn have passed the message on to the community and publicised good news when lives have been saved. In under just 1 year, the number of women attending hospital for emergency obstetric care has risen by 50%. One woman, Salatu Saji, was rushed to hospital in the late stages of labour. She needed a blood transfusion because of complications, and as she said herself, had she been at home, she wouldn't have survived. Thousands of women across Salatu's home state of Jigawa will now have their lives saved because thanks to the example set by local faith leaders, they can have access to the services that they so desperately need. These type of stories of Pastor Maxwell and of Salatu show how people of faith can bind their values to determined and purposeful public policy action in pursuit of ending avoidable suffering and indeed in tackling poverty. Such efforts are urgently needed today, not only because we remain too far from meeting the Millennium Development Goals, but because the twin crises of the global economic downturn and climate change threaten to turn more of the nearly poor into the newly poor in today's world. The latest estimates from the World Bank and the United Nations suggest that some 100 million people have now been forced into poverty as a result of the most recent economic downturn. For the first time, therefore, in 4 decades of progress, more than 1 billion people are going hungry around the world this evening. The spectre of dangerous climate change, much in our thoughts ahead of the Copenhagen summit, already haunts many of the world's poorest people, from the arid plains of East Africa to the shifting shores of Bangladesh. We must, given these crises, take this moment to build an effective partnership for development that sees beyond whatever differences we have and builds from our shared strengths. We must together address the globalization that, in Pope Benedict's words in his most recent encyclical, make us neighbours, but does not make us brothers. I've already spoken of the way that my own view of the world has been shaped by my own religious upbringing. Part of the reason that my parents brought us up to look beyond our own immediate community was because of their own experiences travelling in the world. It was back in 1959, just a week after they were married, that my parents moved from Scotland to the United States to New York to pursue postgraduate studies. While there, they joined fellow students and travelled to North Carolina to protest against the segregation that was still inherent in the south of the United States at the time. I'm proud to say that they picketed lunch counters which would not serve blacks and were spat upon by their fellow whites for their actions. They queued up together to attend the inaugural meeting of the Southern Christian Leadership Council, where they heard the words of a young Baptist preacher. The power of his words made a deep and lasting impression on my parents, and in the years that followed, they would make a deep and lasting impression on our world. That young Baptist preacher, of course, was Dr. Martin Luther King, whose fight for justice challenged the face of his nation. He understood that to have faith commits one to the cause of social justice, that to be a leader within faith gives one a duty to preach beyond individual morality towards a broader engagement with the world as we encounter it. He surely set an example for us all this evening. And when I think of the task ahead of us, it is to his words that I have turned. He said, and I quote directly, "We are faced with the fact that tomorrow is today. We are confronted with the fierce urgency of now, In this unfolding conundrum of life and history, there is such a thing as being too late. Friends, let us not look back on this moment and say that we knew, but we did not act. Let us not, in the years to come, say we acted, but it was too late. Let us instead chart a new course and together embrace the fierce urgency of now. Thank you very much indeed.
I can only speak about Africa because it's the only place I've ever really worked, and I only have my stories. But I think if most people who haven't been there and can remember terrible wars, disasters in Africa, they envisage Western aid workers helping out, helping sick children, and generally being the only recourse that Africans have for the future. In fact, it's not like that. NGOs do good work, I've no doubt about it. But when there is really what we used to call, I say we as a group of journalists used to call really bad manners, murder, rape, roads covered in dead bodies, massacres, confusion, and so on, the NGOs are not there, they leave. They have to, of course. They can't put their people at risk. But in Africa, the churches remain. They always remain, and so do the mullahs. They are of the people, and they are always there. I think of a couple of particular examples. One was Kisangani, just after the third, or was it the fourth payage? That's when Mobutu, the president, Western supported, decided that his army hadn't been paid, and he said to them, help yourselves, and they did. The whole of the city was completely trashed. The only place that survived was the Procure. The Procure is the diocesan house right by the river, a magnificent bastion of sanity and peace. It was like those medieval monasteries that survived those terrible wars in the 8th, 9th, 10th centuries when armies swept by, and somehow civilization, I'll use that word, was preserved in those monasteries. That's what the Procure at Kisangani was like. It was a fortress. It had massive gates. It was a school. It was a bank. It was a university. It was an airline. It was a workshop. It was a hotel. It was a post office. It had a telephone exchange. It was a shop, a massive food store, a petrol dump, a refuge, and a church. These are the sort of places where you find a real, deeply strong commitment, and I think these are the people who carry through places in the really worst of times. The second one I think of is I was on a trip in I think 2003. I went down to South Africa to do a big article on AIDS, and I linked up with the UN and various local NGOs. But after a week, I felt I'd been at seminars, I'd been given statistics, I'd been in offices, and I'd been to one or two projects, but I didn't really feel I'd actually hit what I thought of as the front line. I made 2 telephone calls, one to the local bishop, and then he gave me a number of a parish, and I went to that parish, and within hours, I was in the front line. Queues of people sick with HIV/AIDS, queuing up, being supplied from a church. And again, there they were, right in the front line. And yes, it was a Catholic church. And I said, what do you do about condoms here? And they say, we keep very quiet about them, but there's a box over there, and we generally point people in the direction of that box. So they were actually breaking the Pope's injunction against them and saying, if you want to live, take some condoms home with you. And the third one was in Somalia, when it was, this is actually some time ago, so I don't think I'm not sure if it applies anymore. But in the early 90s, this would be 93, 94, if you wanted to go somewhere where some really good things were being done, Al-Ittihad, which was the Islamic aid agency, was able to supply food and medicine, and they did absolutely fantastic. And you were completely safe there as a Westerner. And there was no terrible clan battles because they had risen above these very horrible clan conflicts that Somalia's wrecked with. So those are three examples of where actually the faith-based organizations were there in the really, really bad times and stayed there. I think one of the reasons for this is that in all my time in Africa, I've only met 3 Africans who are atheists. There is a deep spirituality in Africa, and I think that has channeled into both Islam and the churches and made them very strong. And if you look at the history, the fact is that the churches have done more, dating right back to the 19th century, have done more for health and education in Africa than anyone else. And at a time when the colonial administrators were not too happy about all this education because it might give the natives ideas, the churches went ahead and delivered education to as many people as they could. So I think their contribution in that way has been absolutely immense. But I think in Africa particularly, it builds on not an imported religion, but a very indigenous feeling, and that is a feeling of hopefulness. I'll make one little confession, if I may, before I finish. I'll be very quick. I was the Africa editor of The Economist when they ran the Hopeless Continent cover. I shall always regret that I didn't resign the next morning, because I probably should have done. But it annoyed me, but it puzzled me. But I had no part in it. A lowly Africa editor doesn't choose the cover. But I couldn't work out why I felt so uncomfortable about it. And then I realized that actually, even in the terrible times, and I've seen terrible times in Africa, it never felt hopeless. That Africans' amazing ability not only to survive, but to laugh, to dance, to make a joke out of the most awful circumstances, I think was one of the great strengths of that continent, and I think that will come through when it actually comes together and is a successful continent in other ways, politically primarily, but economically. It will be its gift to the world.
Richard,
thank you
very much indeed. On my last but one trip to Africa, I went to Zambia, and I went and lived with a lady called Joyce, living with HIV for a few days in her hut. And she was a lady, a granny of umpteen, I think 12 children, and she laughed when I asked her how many grandchildren she had. And she was in the rudeness of life. Yet only 3 years she had been on death's door. And the key thing about Joyce was she told me her story. And it was a story of what the local church in her village, in a little mud hut, had done to save her life. They had helped her. Firstly, they'd been challenging stigma because she refused to even acknowledge that maybe she was living with HIV. They helped her then go through the voluntary counselling and testing to discover her status. After discovering her status, she then needed taking to the hospital 50 miles away. She then needed access to the antiretroviral drugs on a continuous basis. She needed the home-based care, and so it went on. That last mile of delivery, which we're all wrestling with health systems, the local churches have so much to contribute. And she said, it's because of the local church. That's why I am now in the rudeness of life. So I really welcome Douglas, your personal reflections on your own, having seen that yourself, in what are Frontline faith communities doing in meeting the needs of people living in poverty. And it's also been really encouraging to see in the white paper a commitment to increase faith funding to faith-based organisations. Over the last 40 years, Tearfund has been trying very, very hard to take a very sharp focus on local churches and what is their contribution to tackling poverty and injustice. How can we mobilise them to care about communities? Because many of them aren't, sadly. But when they do, they take your breath away. How can we help local churches build their capacity to respond to all these challenges? Because even when they're mobilised, they need help in responding to home-based care, if it's HIV or WhatsApp or health education or whatever. They need to be given a voice, because actually they're a profound challenger. They, I think, are a bedrock of civil society in advocating for people, raising issues, advocating for people at a local level, at a national level, and a global level. They do so much, even in times of disasters. I tell you, again and again, it is the local church first on the scene. Actually, the local church is frequently where the Red Cross goes when they arrive to find out what on earth's going on. It's astonishing. And I've been at Tearfund 4 years, and I am struck more and more by just the potential of what local churches can do. Every trip I go on, I see another little story, just like yours, Douglas. I see another story, and there are 3 things that I think are really bringing it to light for me. The challenge of reach in sustainable development. How on earth do we get to these tough-to-reach places? You know, I've been to churches that meet under a tarpaulin in the slums of Mumbai, and there's nothing else there by way of organised civil society. I've been to places in Zambia and other parts of Africa where there's nothing else there by way of organised civil society except local church and other local communities of faith. Key to the reach issue, key to holism. You know, so much of our efforts are focused on physical needs, economic needs, rightly. But what about relational, emotional? What about those issues of hope, meaning, life purpose? I don't know if, I'm sure some of you must have read that article, that Matthew Paris article, Africa Needs God, a confirmed atheist writing an article, and that's what he saw. All these people finding hope and meaning, and that becoming a catalyst to their social engagement. So I don't think it's surprising that we read these statistics. You know, 90% of primary education, Douglas, you quoted in Lesotho, 80% in DRC, 70% in Sierra Leone, moved to health systems, up to 70% in some African countries of frontline health systems, frontline faith communities providing them. Indeed, I would argue, I go further, I've said it already, local churches, local communities of faith are the bedrock of grassroots civil society. They're a crucial means by which social capital is formed in Africa. A crucial means by which social capital is formed. Bridging social capital, the best kind. And indeed, if any of you are RSA members, you will have read in this month's RSA journal, precisely that point is made by David Halpern this month. So if all of this is so, if local faith communities are so central to tackling poverty and injustice, I've got a question for you and a proposal. The question is, well, if they are so central, does the department have a strategy for engaging with these communities of faith? Because I tell you, it would be so helpful to those of us who are working with frontline faith communities, were it so. It would be so helpful. The second thing is the proposal. I'm more and more struck that the evidence of what faith communities are doing, I know it's all out there because I see it all the time when I travel. I see it every trip I see it. But that evidence is so poorly gathered. You know, one of the frustrations is I would love to be able to sit down with you and show you the evidence, chapter and verse of what faith communities are doing in terms of all of the provision they're providing, in terms of everything they're doing for peace building, education, health, you know, so many things. I'd love to give you the evidence, but the evidence is all a bit hard to get hold of. It's all at the grassroots level. It's difficult to get hold of. So I would love to see, one of the things I'm exploring with a number of friends, including the Faith Foundation, I've had conversations with World Vision, other members who have made today possible, is how can we build that evidence together of what is happening at the front line, grassroots, which is where, after all, poverty is overcome. Let's build that evidence. Let's not do it piecemeal, anecdotally. Can't we come together, gather that evidence well, robustly, because I think if we had the evidence, then we would know what works. We would know what is being provided. We would understand why it's being provided. We could replicate it. And then, of course, we could make sure that other efforts are really linked to it. Thank you.